Okay, so a little bit about surveillance. You know, why do you want to do surveillance? Well, there's obviously things that you want to look for that you know, would indicate an outbreak and so forth. Most of the time, those are not very subtle, and they'll just kind of reach up and slap you in the face. So it can be the more subtle stuff, the trends, the ability to show that you're looking and you don't have problems and so forth. And so you need that baseline information. It'll also help to guide you. Essentially, it becomes your compass, you know, to help prioritize your work, and it allows you to compare. And so it provides the basis for your whole program, truly, and you need to do surveillance.
How to aseptically obtain that culture, could you just review that?
Okay. A lot of times when somebody will present, you know, with a, looks like a wound infection, and the first thing you want to do is swab whatever's laying on top there. It looks gross and icky, and it's like, ooh, I'll get this stuff. What you're going to collect is probably the pathogen from the incision, but you're also going to pick up other, typically skin flora, and that can complicate the picture. And sometimes that's going to overgrow in the culture what is actually causing the infection. So it complicates the antibiotic therapy that may be prescribed, or you know, what the physician thinks needs to be done for this infection. So they need to clean the outside surface, and you could use betadine, a chlorhexidine, anything to where you're going to remove, for that matter, you know, just some water, and remove all that excess that's there on top of the skin. And then you want to try to get a little deeper under the skin tissue, or get some fresh pus out of the wound, and that's what you want to culture.
So not to get close enough to where the pus meets the actual flesh. That's where you're going to get your best culture.
Right, I would agree, and that can be kind of painful for the patient, and I'm sure they would prefer that you just collect whatever's running down from the incision, but it would be better for you to get right there at the skin edges. Establishing rapport with people, you always want to be credible, obviously, and that's why you're here. You're trying to enhance that. Make sure that people know who you are. It's really important to put a face to a name. So if there's any way you can, get out and introduce yourself to people, and so they can, when you call and say, hi, this is Susan from Infection Control, I was just calling to see, you know, if you've identified anything, if you got any questions about stuff and all, then they know who you are. And again, that you're not there to create black marks against them or their physician, but you're to help them. You're really there to help them. Always provide feedback. You always want to, you collect this data, then let them know what you found, you put it together, what it may mean or not mean.
The question is, what's the regulation on requirements for hospitals to get back to you when? And does that get reported then back to the surgeon or the facility?
You've never gotten a report. My understanding is to be reported back to the facility, to the infection control person. And partly because the surgeon may never tell anybody that he got this report from anybody, and so you would need to know that. I believe it's in Missouri, I think it's a requirement, but it's a Joint Commission requirement too. And if Joint Commission asks for it, then CMS is going to want it too. So, yeah, it's to happen. I mean, and I think that's another reason to establish rapport with these people in your community. And you know, they may be as surprised as you, because a lot of them are just like you are. They're struggling to learn this, keep up with it, and but yeah. And I've had people say, well, I can't tell you that, it's a HIPAA violation, and actually it's not, because it is related to the patient's care, and so there's a relationship there, and it's relative to what's needed for the patient to be known. So this is just going to be a review, because at this time I figured you'd be thinking, oh, I'm never going to get this, I can't do it, and all. But you know, let's think back over a little bit of what I've said here, and I think maybe you'll learn more than you think. So the first thing you want to do when you're looking for surveillance is to assess the risk. You know, what kind of risks go on in your facility, and think about the patients that you see, and then that'll help to prioritize where you'll spend the bulk of your time searching